At Granger, we're for the ones who specialize in saving the day and for the ones who've mastered the art of keeping business moving. We offer industrial-grade supplies for every industry with same-day pickup and next-day delivery on most orders, all backed by real people ready to help. So you can get the right answers and products right when you need them. Call, clickgranger.com, or just stop by. Granger, for the ones who get it done.
Okay, round two. Name something that's not boring.
A laundry? Ooh, a book club. Computer solitaire, huh?
Ah, sorry, we were looking for Chumba Casino. That's right, ChumbaCasino.com has over 100 casino-style games. Join today and play for free for your chance to redeem some serious prizes. ChumbaCasino.com. No purchase necessary. Void where prohibited by law. 18 plus. Terms and conditions apply. See website for details.
Hey all, welcome back to the Real Life Pharmacology Podcast. I am your host, Pharmacist Eric Christensen. Thank you so much for listening today. Go check out reallifepharmacology.com. Get your free 31-page PDF on the top 200 drugs. Great study guide, great refresher, great preparation if you're taking pharmacology classes or board exams for any healthcare professional. So get that absolutely for free. Simply an email will get you that for subscribing to the podcast. We'll let you know when we've got new content, new episodes available. And obviously we'll get that top 200 study guide out to you as well. So again, go check that out, reallifepharmacology.com. The drug of the day today is Lurasidone. Brand name of this medication is Latuda. This medication is an antipsychotic, and more specifically, it's a second-generation antipsychotic. Mechanistically, how this drug primarily works, and most antipsychotics work, is they antagonize the D2 receptors, or dopamine 2 receptors. And if you remember the yin and the yang between, induced movement disorders, so things like Parkinson's disease, that's generally caused by a deficiency of dopamine. So we supplement with dopamine to treat that. So on the flip side, you can imagine antipsychotics, they block dopamine. They can cause Parkinson's-like symptoms, which often we refer to as extrapyramidal symptoms, which I'll get to a little more in depth in the adverse effect profile. But that's one of the major ways that I remember mechanistically how this works. If you have too much dopamine action in the brain, it can lead to psychotic symptoms. If you have too little dopamine action in certain parts of the brain, it can lead to movement disorders and things of that nature. In addition to the D2 blocking action, it's also got some serotonergic antagonist activity, as well as some partial agonist serotonin activity, and that's 5-HT1A. That's the serotonin receptor, 5-HT1A, that is primarily impacted as the partial agonist activity. Uses of this medication. Understanding that the medication is classified as a second-generation antipsychotic, we can deduce that it's going to likely be used for schizophrenia, and indeed, Lurasidone can be used for that. In practice, I have seen it used for bipolar major depression as well. That's probably the other most common thing I've seen this medication used for. Dosing of the medication. In practice, most patients I'm probably seeing between 40 to 80 milligrams, maybe up to 80 milligrams per day. In schizophrenia, according to the package insert, you can go up to 120, even 160 as the maximum dose there. Keep in mind if patients have a significant hepatic impairment or significant renal impairment, that can impact the max dose. And usually that's going to be 40 to 80 milligrams is the max dose if patients have renal and or liver impairment. So definitely look that up if you aren't sure on that, or if you know your patient has those issues and you're wondering about how high you can push the dose. Definitely take the time to look that up. All right, let's talk a little bit about adverse drug reactions. And first I wanted to start with boxed warnings. So there is 2 of them with lurasidone. So one is the generic warning associated with antipsychotics and an increased risk of mortality when used in elderly patients with dementia-related psychosis. Okay, so that boxed warning exists. In addition to that, there's also the kind of broader generic warning of increased suicidal thoughts in pediatrics and young patients. So that's kind of similar to SSRIs and other antidepressants there. Now, adverse drug reactions. So going through some of the most common adverse effects with antipsychotics in general. So we've got weight gain. We've certainly mentioned the movement type adverse effects. So those are the extrapyramidal symptoms, or sometimes referred to as EPS. Hypotension is associated with antipsychotics, so drop in blood pressure. QTC prolongation, sedation, and extremely rarely neuroleptic malignant syndrome. So those are a few of the big ones there. Prolactin levels can be elevated in patients due to antipsychotics. Also, anticholinergic activity can be part of antipsychotics adverse effect profile. Now, why you would select lurasidone versus clozapine versus risperidone, the adverse effect profile plays a huge role, as well as the evidence supporting the indication, what we're going to use it for. But the adverse effect profile plays a huge role. And there's definitely some advantages and some potential disadvantages with lurasidone. So I'm going to run through some of the things that I think are really important from an adverse drug reaction standpoint. So anticholinergic activity with lurasidone is really low. So as patients age, lurasidone tends to have lower anticholinergic activity, which is great. That's definitely an advantage on its side compared to a drug like clozapine, and a second-generation antipsychotic like clozapine, for example. That has much higher anticholinergic activity. QTC prolongation has not been shown to be incredibly high with lurasidone, so that's a good thing as well. A drug like ziprasidone has much greater association with prolonging that QT interval. Weight gain, where does lurasidone fall there? Generally, it's on the lower end of risk of metabolic syndrome, weight gain, so that is a really good thing there. Whereas a drug like olanzapine, clozapine, those are definitely on the higher end of the scale of potentially inducing diabetes and causing weight gain and all those negative metabolic effects. Now, some antipsychotics have alpha blocking activity, and they vary, of course, based upon which drug you're talking about. But lurasidone tends to be on the lower end of having alpha blocking activity. So that means we've got a lower risk for dropping that blood pressure or hypotension versus a drug like clozapine that has a much higher risk of alpha blocking activity and risk for hypotension, that drop in blood pressure. Prolactin risk with lurasidone is low. So compare that to, let's say, risperidone, which is much higher. So that's a potential advantage in its favor. Other adverse effects that might come up when comparing antipsychotics. So certainly the extrapyramidal symptoms. Lurasidone is probably in the middle of the playing field there as far as antipsychotics in general. And then sedation is another one that always comes up too. You want to clinically assess your patient. Are they already overly sedated? Are they, could they use some sedation? Do they have a lot of trouble with insomnia at night? And there again, lurasidone falls kind of in the middle of the pack. When we think of sedation, I definitely think of quetiapine probably being one of the more sedating second-generation antipsychotics there. But all these adverse effects come into play when we're assessing patients, looking at what they're at risk for, whether it's QT prolongation, whether it's weight gain, whether it's anticholinergic burden. All those factors should play into deciding what antipsychotic we're going to use, as well as we're certainly going to factor in what the appropriate indications are and what the best clinical evidence supporting that indication is. So those are definitely important factors in selecting which antipsychotic you want to use. One last, sometimes overriding factor in selecting an antipsychotic is cost. And lurasidone at this time is still fairly expensive compared to a lot of the other antipsychotics that have been generic for a long, long time. So cost definitely can be an issue with lurasidone, which is a downside to the use of this medication, of course. All right, one other clinical pearl that I definitely wanted to mention was administration. Okay, according to the package insert, this drug is best given with food, and they specify at least 350 calories. Okay, so basically we're going to want to take this with a meal. And the reason being is that maximizes the absorption of the medication. So in patients that are not responding to this medication in clinical practice, that's definitely a good time to ask how they are taking the medication. Okay? Obviously, we're going to look at drug interactions and other things too, but asking about how they're administering the medication and if they're taking it with food can definitely help improve that absorption and potentially increase concentrations, which ultimately could lead to increased effectiveness of the medication. Lastly, let's talk about monitoring parameters before we get into drug interactions. So, of course, we're going to monitor for metabolic syndrome, blood glucose, lipids, things like that. Prolactin levels could be checked. That's probably going to be as clinically relevant. So if a patient's, reporting sexual dysfunction, something like that, and we think it's from the lurasidone, you might consider doing a prolactin level there to see if that's indeed what the cause is, something like that. Or if there's using this medication in females and we've got, inappropriate changes in milk production, things like that, that's definitely a situation where we would potentially look at a prolactin level. Now, I would say in practice, you're not going to typically routinely check a prolactin level unless there's issues. Then you might start digging into the problem and go from there. And then vital signs, we're going to monitor, of course, blood pressure, specifically there to help monitor that therapy. All right, let's take a quick break from our sponsor and we'll wrap up with drug interactions. If you're in the market for pharmacist board certification study material, like BCMTMS, BCPS, ambulatory care, geriatrics, the psychiatric exam, definitely go check out meded101.com/store, S-T-O-R-E. Got a growing list of resources there, full, complete packages to allow you to prepare for your exam appropriately. In addition, we've got NAPLEX content, so if you're a pharmacy student, if you're a nursing student, med student, PA, nurse practitioner, any of those folks, we've got great resources, clinical practice resources, case studies, drug interactions, food medication interactions, all sorts of books on Amazon that can really help you throughout school and in your practice as well. They also make great gifts if you've got students with you that are looking to hone their skills in medication management. So again, all those links you can find at meded101.com/store, S-T-O-R-E. All right, let's wrap up with drug interactions. CYP3A4 is important. So this drug is broken down to a significant extent by CYP3A4. So CYP3A4 inhibitors can increase concentrations. So classic example there being grapefruit juice. So that's definitely something you want to educate patients on to avoid. And then we've got CYP3A4 inducers, which could lower concentrations. So classic examples there, St. John's wort, carbamazepine. And if you go back, I believe it was in the simvastatin podcast, or maybe the statin podcast in general, I definitely talked about a few more CYP3A4 inhibitors and inducers. I can refer you back to that podcast if you want more examples there, or you can simply do a quick Google search there as well. Other interactions besides the CYP3A4 pathway are really going to be additive effects. So I think of metoclopramide, for example, has significant potential to cause EPS. It has dopamine blocking activity, could definitely have additive effects onto lurasidone and increase that risk for extrapyramidal symptoms. Another potential additive effect that I wanted to mention was CNS depressant activity. Remember, I kind of said lurasidone's in the middle of the pack as far as causing sedation with second-generation antipsychotics. So certainly adding on other medications that can cause sedation can have additive effects. Classic examples being, benzodiazepines, Z drugs like zolpidem, opioids. These are all meds that can really cause CNS depression and have additive effects on lurasidone. All right, well, I think that's going to wrap up the podcast for today. Thank you so much for listening. Please take the time, leave a rating, review on iTunes or wherever you're listening. Share the podcast, reallifepharmacology.com, with friends, colleagues, students, preceptors. Help us grow the podcast and obviously help others learn about medication management as well. If you want to reach out to me, Eric Christensen, PharmD, BCPS, BCGP, you can connect with me on LinkedIn. Otherwise, you can track me down, mededucation101@gmail.com. With that, I'm going to sign off for today. Thank you guys so much for listening. Please support our sponsor, meded101.com/store. And I hope you have a great rest of your day.
For the ones who get it done, the most important part is the one you need now. And the best partner is the one who can deliver. That's why millions of maintenance and repair pros trust Grainger, because we have professional-grade supplies for every industry, even hard-to-find products. And we have same-day pickup and next-day delivery on most orders. But most importantly, we have an unwavering commitment to help keep you up and running. Call, click Grainger.com, or just stop by. Grainger, for the ones who get it done.
Judy was boring.
Hello.
Then Judy discovered ChumbaCasino.com.
It's my little escape.
Now Judy's the life of the party.
Oh, baby, mama's bringing home the bacon.
Whoa, take it easy, Judy. The Chumba life is for everybody. So go to ChumbaCasino.com and play over 100 casino-style games. Join today and play for free for your chance to redeem some serious prizes. ChumbaCasino.com. No purchase necessary. Void where prohibited by law. 18+ terms and conditions apply. See website for details.